So with this great faculty team that we have lined up for the symposium, I really wanted to highlight the level of expertise in the agenda. And so, with this lineup, I really wanted to have a lot of panel discussions. And so there are 3 different panel discussions, each 1-hour session. The first panel discussion will be right after Dr. Dan Nelson's 1-hour lecture on the DEWS-2 report. There's really nobody better in the country to give us a good explanation or kind of a detailed look at what the DEWS-2 report has brought to us and how we can translate that clinical data into the best patient outcomes. So each panel discussion will have some topics in there that will help guide the discussion. For instance, we'll talk about pain management in dry eye, iatrogenic dry eye management, and pain sensation and how to take care of these patients. The second panel discussion will feature kind of the theme of how do we take our skill set to that next level in dry eye? Not just the mild bucket of patients, if you will, but those patients that might have other chronic problems in addition to that might be driving that tear film instability, like floppy eyelid syndrome or conjunctival chalasis. What do the experts do with these patients, and how do they treat them, as these conditions can certainly be a chronic driver of chronic inflammation. The third panel discussion will be a really fun one. It's going to basically be talking about a day in the life of the ocular surface disease expert. And some things will be clinical, and other things in that panel discussion will be kind of more administrative. As the ocular surface disease expert in your clinic, you're going to be the one that is going to be the most knowledgeable, most passionate about your ocular surface disease service. But how do you have your team around you, supplementing what your assessment and your plan is for your patient? Topics like this, what do we do with Demodex these days, and where do we fit punctal plugs on the clinical side of it? I'm really interested to see through these panel discussions is the unscripted discussion that will and debate that will happen through the discussion. So with this amazing group, I'm really looking forward to those discussions. But in addition to that, I really wanted to make sure we have some workshops. And one of them will be ocular surface disease devices. Really, that will mainly highlight intranasal neurostimulation. What does it feel like? How do you prescribe it? And what patients do you choose to recommend this to? And then getting your hands on the device itself and seeing what the treatment feels like. And the second workshop will feature sutureless amniotic membranes, how to insert them and remove them properly. The agenda is really going to be, featuring panel discussions and workshops where we get hands-on experience and really looking at, the pertinent clinical studies and looking at an evidence-based approach to learning. And so I think we have a terrific agenda lined up, and I'm really looking forward to your involvement in these lectures, and I'm looking forward to being a part of it as well.